On April 27th, the UPenn Prevention Research Center hosted the Student Public Health Pitch Competition, where undergraduate and graduate students proposed ideas and projects to solve some of today's most challenging public health issues. The PRC is dedicated to supporting students in their public health education and endeavors. This competition furthered that mission by providing them with the opportunity to practice presenting and pitching their ideas and connecting with faculty who are also involved in public health and prevention health research. 8 undergraduate students and 6 graduate students had 7 minutes to describe a public health problem and pitch an innovative solution, project, or idea to solve the problem. A panel of national experts from the network of prevention research centers across the country were present to judge the students based on a rubric. The audience also had the opportunity to vote for their favorite presentation. We would like to thank all of the students who participated in our competition and for all of their hard work on their projects and presentations. Our winners were Lyon from the College of Arts and Science, Suyatha Shangalkar from the College of Arts and Science, and Matt Micletta, who is in the master's program at the School for Social Policy and Practice and in the Master's for Public Health. Now you'll hear from some of our winners.
My proposal for the public health pitch competition is Take Back Our City. Take Back Our City aims to increase the number of prescription take-back locations in Philadelphia. We believe you should be able to return your prescription medications where you got them in the first place, the pharmacy. We designed a pilot study to assess the effectiveness of prescription take-back in pharmacies throughout Philadelphia. The initiative started through the Penn Public Policy Challenge. This was a team competition and a team effort. We focused on the opioid epidemic because we knew it was impacting Philadelphia, where 910 people died from drug overdose in 2016, where it impacted us personally, and where it impacted many of you probably watching this video right now. One day, my partner wanted to return some unused prescription pain medications. The very next day, I received a text message from the pharmacy notifying me that I had a medication ready for pickup. It was in this moment when I realized drug take-back is too complicated, and we already have the infrastructure in place to remind patients to return their unused prescription medications. Medications are often left over after procedures and often linger in medicine cabinets for years at a time. Most people who misuse prescription pain medications get them from a family member or a friend. This poses an unnecessary risk in the household. I'm really passionate about this proposal. We've already raised $6,000 toward the pilot study, but we need more funding to have a quality study that will influence policy here in Philadelphia and beyond. The Prevention Research Center offered a platform for us to get this message out further. There is no silver bullet in the opioid epidemic, but we want to empower community members to do their part.
As a pre-health student at the University of Pennsylvania, I've had a lot of unprompted discussions about student health services here at Penn. There seems to be a dichotomy of students that arise: people who seek out care when they fall sick and people who don't. There isn't a lot of research being done in the college-going population about access to care. These were some of the motivations behind the project that I presented at the Public Health Pitch Competition. I explored key promoters and barriers that influence Penn students' interactions with the student health system. After conducting semi-structured interviews and doing qualitative thematic coding, I came to realize that there are key influences on why students do and do not seek out care. The key promoters include mandatory health events, as well as influences of family and peers. The key barriers included inconvenience of distance and time, inability to book an appointment within an appropriate time period, and surprisingly, lack of information about how insurance worked. As a rising senior, I hope to take this one step further and implement solutions that can address these issues. Several solutions that I was able to come up with included developing an app or web-based platform that makes scheduling appointments easier, increasing awareness about the different programs that SHS hosts beyond general checkups, as well as developing information about how insurance works. It was an amazing opportunity to participate in the public health pitch competition. It was my first time presenting findings in my public health research to an audience not only filled with people who aren't involved with public health, but to experts as well. I was able to receive great feedback and understand the plethora of research being conducted in public health right now.